Hello everyone, I'm Jeff Archibald with TV Hamilton. I'm joined by Drs. Lichter and Dr. Parker. We're going to talk today about some amazing technology here at Kettering Health Hamilton, the Vinci Xi robot. And first of all, Dr. Parker, tell us what makes this robot special. What makes this robot unique and different?
So the Xi robot is the most advanced robot that we have to perform surgery with for general surgery, urology, gynecology. Most surgeons are starting to adopt the robot. The reason it's so advanced is because it gives us the ability to basically go inside the body ourselves and fix things in a sense that we use small incisions. We go through a camera inside the body and we make tiny little cuts and have a zoomed in field to give a very precise, safe, and pain-free surgery.
Yeah, and Dr. Lichter, one thing we've been talking about, if you want to give him the mic there, Dr. Lichter, one thing we've talked about is, we were talking about before we were on camera, the main thing about this is it really cuts down recovery time, doesn't it? And it's really about the patient care.
Yeah, absolutely. I mean, we've been doing open general surgery for decades, now laparoscopic surgery since, the early 90s. Moving now to the robot platform, it affords us a better view of the patient, like Dr. Parker said, less pain, less blood loss, and even in some cases, lower infection rates, lower hernia recurrence rates. For the really large hernias is just super exciting.
And you were talking about recovery times. People have to spend a lot less time in the hospital.
Absolutely. For our very large hiatal hernias, the ones that it's a hernia where your intestines and your stomach are stuck way up behind the heart. Some of those can be very challenging laparoscopically, but when performed robotically, our patients are going home the next day.
Which is amazing. Before this technology came along, how long were they in the hospital for roughly?
Yeah, so for some of the cases, you'd have to trim the stomach in order to get enough length, or even go to an open procedure because it just simply couldn't be performed laparoscopically. Open procedures, they'd be in the hospital a week.
So we went from 7 days down to 1 day now.
Yeah, for the robot versus open.
And Dr. Parker, one thing that you had talked about with me also, it's amazing that because of less recovery time, because of less pain, it's cutting down on the need for as many narcotics for patients. That to me is a big deal, right? That's something very important.
There's been a big push for healthcare nationally, and the robot's been a big part of that, decreasing the amount of narcotics that we have to give to patients post-operatively. And so when they're in the hospital, they've got a button to push for narcotics, especially with these big cuts, big open surgeries, because they're more painful. And so patients are going home with a few pills, and they oftentimes don't even take them. And it's cutting down on just the opioid crisis.
And this is a really kind of I don't want to say it's a rare machine, but there's only one other of these in Butler County, correct? So the fact that there's one in Hamilton is a really big deal for Hamilton, I would have to imagine.
Absolutely. I think that our hospital is very dedicated to advanced technology and updating all the facilities here at Fort Hamilton, or Kettering Health Hamilton now, since we've rebranded. So there are other robotic platforms out there. The Vinci Xi platform specifically is the most advanced version of Intuitive's robot, and there are two in Butler County, and we have one of them. Very exciting.
And to me, that's exciting because that means people don't have to leave Hamilton, don't have to leave Butler County to get this kind of treatment.
Yeah, care close to home is our #1 mission. We want to provide cutting-edge, academic-level care that's pushing the frontiers of general surgery right here in your backyard.
And talk about in your backyard. Coming up on Tuesday and Wednesday, you guys have a great event. People can come out and see this thing for themselves over at Jungle Gyms, right? Tell us a little bit about the event you guys got going on. What do you know about that?
Well, Dr. Lichter's been planning this thing in his head for years. So I'm going to let him talk.
Yeah, that's perfect.
I'm probably the biggest fan of Jungle Gyms. We had our wedding reception there and my first date there. Jungle Gyms is a fantastic place. If you've never been, definitely go. We've paired with them to create a really unique event where we're partnering with several different people, our mesh representatives for surgical mesh, the actual robot representatives. We're bringing a robot on site. We're going to be having a food tasting by Jungle Gyms. It's about increasing access to care. It's about debunking myths about mesh and just trying to just make everything a fun-filled event where people can come out, try the robot, learn about hernias, get some free food, and enjoy a nice evening.
Yeah, I think that's really cool that you're going to let people see it. What are some of the concerns people have when you start talking about robotics? Do people get a little bit concerned? Is this a way for you to alleviate some of those concerns when they can see them?
I think so. I think there's a misconception about a lot of things in healthcare, and with the robot specifically, they think that the robot's doing all the work. And they'll see that we are very in control of every little piece of this. They'll see how zoomed in the views are. They'll feel the mesh themselves. They'll have some trial pieces where you can pick up and feel it and not be so concerned about mesh being implanted in your body. And we'll be able to kind of debunk some of the myths involved with hernia repair specifically.
I think one of the things when I saw the machine myself, I think when you talked about it, the tool size of what you're doing now is so tiny, right? Is that what makes this thing special? Is that the technology that makes this really cool?
Totally. Short answer, yes.
Yeah.
When you look at these kinds of tools that you have now, is there anything different you can do, or is it just more about patient care? Is it about being faster with the surgeries and being able to turn out things a little bit quicker?
Well, it started out with, all of general surgery having to prove the use of the robot. In order to get robots, you have to prove that they're useful. And so that's kind of been a long process, but now you're seeing them pop up everywhere, so they have proven that utility. And that's because of the decreased surgery times. The more complex surgery are easier to do with smaller incisions. And there are some places that we do surgeries like these bigger abdominal wall surgeries that you couldn't perform laparoscopically. So you're either doing it open or you're doing it robotically. And we're trying to perform all of our large complex hernias, if possibly done safe with the robot, to give these better outcomes.
Finally, for both of you, what do you guys want people to know about this Da Vinci Xi robot?
I think the biggest thing is to realize that we've been doing surgery safely for a long time, but the Da Vinci robot is about taking it to the next level to afford us the most cutting-edge technology to give you the safest surgery with the least amount of pain to get you back to health faster than ever.
That's amazing. That's amazing. It's right here in Hamilton.
Right here.
All right. Hey, thanks a lot, guys, for joining me. That's Dr. Parker. That's Dr. Lichter. I'm Jeff Archibald. Go out, check them out Tuesday night and Wednesday night at Jungle Gyms for a great event, food, and you'll get your chance to see the Da Vinci Xi robot for yourself in action.